Hello and welcome again to Learning Medicare with AMS. My name is Daryl Russell. I'm a licensed agent with Affordable Medicare Supplements, or AMS for short. And today I want to address a question that we get quite frequently. What is the difference between Medicare Supplement and Medicare Advantage? And this is a subject that's easy to get confused, so forgive me, I took quite a bit of time to put a video together. It's going to be a little bit longer than I might normally do, but I think you're going to like it. I've really worked hard at putting together all of the information you need to fully understand the difference. So we're going to talk today about, we're going to define original Medicare and a supplement. We're going to look at a claims example for the Medicare supplement. Then we'll define Medicare Advantage, look at a claims example. We'll do a side-by-side review to wrap it all up, and then stick around at the end. We'll tell you what people commonly like about each different type of plan. So let's go ahead and get right to it, shall we? Okay. So again, I'm going to challenge you to not think about Medicare Advantage versus Medicare Supplement, but rather what's the difference between Medicare, original Medicare, combined with a Medicare supplement. Okay, so let's take a quick definition and look at what exactly I mean and what the government booklets say by original Medicare combined with a supplement. Well, our snapshot would be this. Here's original Medicare. You start with Part A, hospital inpatient. Most people don't pay a premium. It has its own separate deductible. And then Part B is your medical coverage, doctor's visits in and out of the hospital, labs, x-rays, MRIs, that type of thing. Most people pay the standard monthly premium of $148.50, although some can be higher, and there is a separate deductible. So those pieces put together make up your red, white, and blue Medicare card. If you want prescription coverage under Part D, then you need to add that to your red, white, and blue Medicare card. There will be a separate monthly premium, typically $10 to $30. It can be a little bit more, it can be a little bit less, but for most people, that's a safe range. And you're adding that card to your red, white, and blue Medicare. And then Medicare Supplements, you add this to original Medicare to cover the unlimited 20% not paid by original Medicare and the deductibles, and we're going to talk more about that. You will pay a separate monthly plan premium, anywhere from $100 to $200 a month or more, based upon age and where you live. So your original Medicare snapshot looks like this. You have 3 cards with 3 separate monthly premiums, and original Medicare pays the claim first, and the leftovers go to the supplement. There are no networks. If the medical provider you see bills the red, white, and blue Medicare, then the supplement has to pay by law, period. Over, done. Very, very little out-of-pocket cost for your medical services. It's a prepaid convenience. That monthly premium covers most, if not all, of your leftover medical costs. However, one drawback is you do not have coverage for routine vision, dental, or hearing. Okay. So let's take a look at some key facts about original Medicare or your red, white, and blue Medicare card. First of all, original Medicare Part B only pays 80% of its approved charges, and the leftover 20% is unlimited. So for example, if you had over $100,000 of approved Part B charges, Medicare is going to pay their 80%. You're appreciative, but your 20% is $20,000. And there's no cap on that, so that number can keep getting larger and larger. It's for that reason that most people who choose original Medicare add a Medicare supplement, because by law, the supplement has to come in and pick up that leftover 20%. So here's some key facts about Medicare supplements. Number 1, Medicare supplements are all standardized by federal law, meaning all the plans are the same. The premiums vary widely from company to company. And in today's world, we see more Plan G and Plan Ns are selected by most people commonly today. Medicare supplements can only pay when original Medicare approves that service first. And remember, they're supplementing Medicare. So Medicare supplements can't cover routine vision, dental, or hearing by law, because original Medicare doesn't cover those services. So that's clears up a little confusion on that. We're going to go ahead and for background, we're going to take a look at standardized Medicare supplements. If you've watched any videos on supplements, you've seen this chart. This is the federal standardized chart. And the first column is your gaps or your leftovers, as I like to call them, of Medicare. And we're going to look at a claims example in a moment. We're going to look at the Medicare Part B coinsurance, and that's that 20% that Medicare doesn't pay. And if you're looking at a Plan G or a Plan N, they pay 100% of the leftover 20% under Medicare Part B. Okay? There is one example with Plan N that's unique to it, and that for a lower premium, when you go to a doctor's office visit, you pay the 20% that Medicare doesn't, up to a cap of $20. And for emergency room visits, you pay the 20% that Medicare doesn't under Part B, up to a $50 cap. All of your other Part B services, your MRIs, hospital, doctor visits while you're in the hospital, that 20%, Plan N picks up all of that, okay? In our claims example, we're also going to take a look at the Part A deductible, and in 2021, that's $1,484, and you can incur this multiple times. And so you'll see that Plan G and Plan N also pick up that Part B, that Part A deductible, excuse me. One thing that is unique is that medical services under Part B have a one-time calendar year deductible, and in 2021, that deductible amount is $203, and the Part B deductible can and does typically increase every year. The uniqueness is that Plan C supplements and Plan Fs are the only ones that are allowed to pay 100%. However, if you can only buy a Plan A, Plan C, or Plan F supplement if you've had Medicare Part A in effect on your red, white, and blue Medicare card no later than December 1, 2019. So if your Medicare Part A effective date on your red, white, and blue Medicare card is January 1, 2020 or later, federal law now requires you to pay the Part B deductible out of your own pocket. You are blocked from buying a Plan F or Plan C. You have to pick from the remaining standardized plan options, and it's really not a big deal. Again, Plan G and Plan N are very commonly selected, and the $203 deductible, for most people, it's not a big deal. Okay, so now let's go and look at a claims example under Original Medicare combined with a Medicare supplement. Okay, so again, I just kind of pulled some numbers out of the air to try to give some crystallization, but we're going to assume that you have a 3-day hospitalization under Original Medicare and Medicare approves it. So first of all, you owe the Part A deductible of $1,484. And then while you were in the hospital, you had, in this example, $5,000 just randomly pulled from the air in doctor services, okay? So Medicare Part B is where the doctors file their portion to, and Medicare Part B pays 80%. You pay the 20% or $1,000. And this example assumes that you've already satisfied that Part B deductible. So the total obligation after Medicare pays for this hospital admission is the deductible of $1,484 under Part A, the $1,000, the 20% coinsurance of $5,000 under Part B, and in this example, those total $2,484. And remember, this is just Original Medicare. So now let's slide in our Medicare supplement on top of. So if you have that Medigap plan in addition to Original Medicare, the supplement pays those leftover charges, the deductible of A, the 20% of Part B, and then after the Medicare supplement pays on top of Original Medicare, this is what you owe, $0. People love it. It works very, very well. Okay. So now let's take a look at Medicare Advantage. And here's our snapshot of Medicare Advantage. First of all, your Part A hospital inpatient coverage and your Part B medical is all combined into the one plan. Typically, there are no separate deductibles. Part D drug coverage is usually included with no additional premium. And you have a Medicare Advantage card, which wraps up all those services. So you have one card to manage. You must use planned network of doctors, and we're going to talk more about that. You may need a referral from your family doctor to see a specialist, cardiologist, urologist. I tease people, if you hear IST in the doctor's title, he's a specialist. It's a pay-as-you-go plan in exchange for low or $0 premiums. Now, you must always continue to pay your Part B monthly premium to the government. Now, the doctors and hospitals only bill the Advantage plan, not Original Medicare, and then you pay your copay to either the doctor or the hospital or the other medical provider. The plans by law have to limit your out-of-pocket costs for in-network providers. And in some cases, you may get extra benefits like routine vision, dental, hearing. There's a bunch of additional ads you may find in a plan. So let's look and break down those pieces a little bit more in depth here. Okay, key fact number one. Another way to receive your Part A hospital and Part B medical coverage by enrolling with private companies approved by Medicare. That's why it's called Part C. It's part of the Medicare entitlement program. If you join a Medicare Advantage plan, you still have Medicare, but you only show your doctors and hospitals your Advantage plan card. You must continue to pay your Part B monthly premium at all times. And the Medicare agency, CMS, they pay a fixed amount of money for your coverage each month to these companies that offer Medicare Advantage plans. These plans use these dollars to pay your Medicare coverage services. So when you hear you must continue to pay your monthly Part B premiums, that's part of the dollars that CMS gives these Advantage plan companies on your behalf. Now, the reason you find many Medicare Advantage plans at a very low or even zero monthly plan premium is because of the federal funding the Advantage plans receive each month from CMS on your behalf if you decide to join an Advantage plan. The Advantage plan companies under their contract must follow rules set by Medicare in order to continue to receive those federal dollars. But Medicare Advantage plans do combine all your coverage under inpatient hospital Part A and doctors' medical services under Part B all into one plan. So you end up with only one cost sharing. The multiple deductibles of Original Medicare are replaced with a copay or a co-insurance. Most Medicare Advantage plans, again, include the Part D drug built into one plan. You will pay a copay or a co-insurance when you receive care, and that's why we call this a pay-as-you-go type of plan. However, you must typically use planned doctors and hospitals or pay a higher out-of-pocket cost. And the plans are required by law to limit your out-of-pocket medical expenses to no more than $7,550 in a calendar year, again, when you use the planned doctors and hospitals. Your annual cap, or maximum out-of-pocket, sometimes referred to as a MOOP, can be much less, but it can be no more than $7,550. You may need referrals, Mother May I slips, if you will, permission slips to see a specialist, and you may need prior authorization from the Advantage plan for certain plan services. Prior authorization doesn't apply to everything. It's the more expensive services, and that can also vary widely from plan. You may find the additional benefits like routine vision, dental, hearing, gym memberships, and a lot of other things that you don't find in Original Medicare. So if you're used to group insurance where you work today, where you have copays and networks and that type of thing, Medicare Advantage will look very, very similar to that. So let's look at a claims example, and we're going to use that exact same dollar amount that we used before. So we're going to assume you have a 3-day hospital inpatient admission, and just like under Original Medicare, you had that $1,484 deductible, plus the Part B services, and so on and so forth, we came to, with original Medicare, you would owe $2,484. But remember, with Medicare Advantage, original Medicare doesn't get the bill. It only goes to the Advantage company. So it's going to look different. It's going to look more like this. If you have Medicare Advantage instead of original Medicare, the hospital only sends the bill to the Advantage plan, not original Medicare. You pay a per-day copay for the hospital admission typically, and for this example, we're going to assume $300 a day because you can find a lot of plans in that ballpark out there. So again, original Medicare doesn't get the bill. Instead, it goes to your Advantage plan card. And for this hospitalization, 3 days of copay at $300 a day, that's $900. Your Part B services, since they're combined into the plan, there's no separate deductible. That copay above the $300 per day includes your doctor services under Part B. So in this example, you owe $900. Now again, it's still a bill, but it's significantly less than original Medicare. So let's review how this works side by side. And here I've got on the left Medicare and the supplement versus Medicare Advantage. So first of all, with Medicare Part A and B, you do have separate deductibles that apply, and you always have to pay your Part B premium. Under Medicare Advantage, your A and B coverage is combined into the one plan, and again, you still have to pay your Part B premium to the government. With Medicare and a supplement, there's no maximum out-of-pocket protection under Medicare. Your Part B 20% is unlimited. Under Medicare Advantage, there is a maximum out-of-pocket of $7,550, but many are significantly lower. $3,000 to $4,000 is not uncommon. Because of the unlimited 20% with Medicare, most people opt to buy the supplement to pick up that deductibles and that 20%, and typically you're looking at $100 a month or more, depending on your age and where you live. With Medicare Advantage, you don't need a supplement. You can't use it. The Advantage plan has the built-in limit, so you're not spending extra money on that. With Medicare and a supplement, however, you can use any doctor, any hospital, any medical provider who will bill the red, white, and blue Medicare card. No networks, no referrals, no specialist needed, no prior authorizations. In the Medicare Advantage, for the lower premium and some of those built-ins, you must agree to use planned doctors and hospitals, typically in either an HMO network, which is very small, lower copays, PPO networks, a little bit more broad coverage outside of the network for more copay. But again, depending on the plan, you may need referrals from your family doctor to see a specialist, and you may need prior authorizations from the plan in order to receive certain services. Looking again, Part D drug coverage with Medicare and a supplement, you must buy that separately and pay the separate monthly premium. In Medicare Advantage, you typically will have Part D drug coverage built in, usually with no additional premium. Medicare and a supplement, no routine dental, vision, or hearing, you're going to buy that separately if it's something you want. In Medicare Advantage, it's not uncommon to find dental, vision, routine hearing, and a lot of other additional benefits included, typically at no monthly additional monthly premium. Medicare and the supplement, well, your Part A and B deductibles can increase every calendar year. And under Advantage plan, its benefits, its copays, its extra benefits can also change every year. You can always change Medicare supplement plans later on to go with your original Medicare, but you may need to answer health questions, and you can be denied or postponed when you're applying for a Medicare supplement more than 6 months after your Part B effective date. With Medicare Advantage, since it's part of the Medicare program, it's a Medicare entitlement, you can change your Advantage plans yearly, no health questions, no underwriting, at the annual enrollment period, which happens October 15th through December 7th of every year, and your new plan takes effect January 1. Now, with Medicare and a supplement, and again, to add the supplement to original Medicare, you have no health questions if you apply within the first 6 months of your Part B effective date. Medicare Advantage plans, there's no health questions ever to enroll in a Medicare Advantage plan. It's an entitlement program. If you later wish to switch to a Medicare Advantage from a Medicare supplement, this is relatively easy to do. There's no health questions that apply to switching to an Advantage plan. However, if you have a Medicare Advantage and you later wish to switch to original Medicare and the supplement, you may very well have to answer health questions for that supplement, and in some cases, you could be turned down for supplemental coverage. Now, there are some circumstances where federal law guarantees Medicare supplement companies must accept you regardless of your health history. These are limited, and we can answer more questions about that if you've got them. Medicare Advantage does give you a trial right. So you can join a Medicare Advantage plan for the first time. And if any time within that first 12 months you decide you don't like it, you can leave, switch back to original Medicare, and get a Medicare supplement, no health questions. So I've tried to do a pretty decent job of looking at, hopefully, I hope you agree, objectively Medicare with a supplement versus Medicare Advantage. But now I want to take a moment and just kind of look at, well, what are some of the things that people like about each type of plan? Well, obviously with Medicare Advantage, if you can get it for a $0 premium, now again, you always, and in case I missed it, you always have to pay your Part B premium to the government. That's true of Medicare with a supplement or Medicare Advantage. But with the Medicare Advantage, you in many cases have no monthly premium. A lot of people like that. Medicare Advantage is a pay-as-you-go plan. In other words, you'll have copays. We only talked about hospitalization in this example, but you will have copays for doctor visits, specialists, emergency room, ambulance, all those type of things. Again, if you're under 65 or you've recently had group insurance where you paid $10 for this doctor copay, $50 for that one, so on and so forth, Medicare Advantage will look extremely familiar. And many people who pick Medicare Advantage, they don't mind paying $10 for this doctor 2-3 times a year, and then maybe that's all they pay, okay? You do have to be comfortable with the network and know the limitations of that and all that type of thing. What do people like about Medicare with a supplement? Number one, they just want to pay a premium and not worry about anything. I don't want to worry about this doctor being in network, that doctor not being out of network. I don't want to worry about the leftover bills. All I want to know is I pay my premium and everything's taken care of. And if I need to go to the doctor 100 times a year, I've got it all taken care of. And there is a certain amount of peace of mind that comes with that. And most people who buy Medicare supplement is because they just don't want to fool with copays. They want to know what their budget is and they're taken care of. And the extras like routine dental, vision, hearing, they're fine with buying them separately, or they never used them. It wasn't important to them type of thing. So I like to say it's a math question. I like to challenge folks that when we come in and talk to sit down and think about your Medicare decision as a 20-year decision. In other words, if I'm paying $100 a month for a supplement and $20 for a drug plan, over the next 20 years, how much does that add up to? Can I afford to keep paying for that as I get older? Because the supplement will increase in premium. Those deductibles that they increase of original Medicare, the supplement by law has to pay the increases. So that puts even more pressure on the supplement to raise rates because it has to pay more every year. Okay, so you want to factor that in. With Medicare Advantage, over that same 20 years, if you're not paying for the supplement, are you okay paying the copays? And you could have many years with Medicare Advantage that you pay significantly less in out-of-pocket, your copays total, than if you buy a supplement premium. But you need to be prepared for the fact that you might have 1 or 2 or 3 years come along where you might have some major medical expenses, cancer treatment, heart surgeries. I see it similarly with knee surgeries, physical therapy copays, that, where you might have a rough go where you might pay more in a year with Medicare Advantage than if you'd done the supplement. But it's doing the math. Over that 20 years, how does the numbers add out in average? So there's a lot more to it. I'm trying to give you as much information, yet keep it as short and sweet as possible. You're going to have questions. You're going to have other things. Feel free to give us a call. Visit our website. I'm always available to help answer questions. And as always, folks, if you like the video, give me a thumbs up. If you've got suggestions, things you'd love to have us make videos about, leave that in the suggestion box below. As always, we thank you for watching. Hope you have a great day. Take care, folks. Bye-bye.